Well, joining us via Skype from Bonny River State is Tessie Biobako, a gender advocate. Good morning and thank you for joining us. Recently,
Good morning.
right.
On board.
All right, we saw a video making the rounds about a young girl whose mother was speaking to her about the fact that some shops were closed and the fact that she couldn't get her some items. And would like to know, from your point of view, how this is impacting children and mothers and what can be done to, ensure that children are safe.
Well, the video, I would suggest that the mother could have just made her understand that we have to, it is what it is right now. There are certain things that we must try to look at. Okay, what can we make the best use of for now? I mean, we can't have everything. We must live within the contents of this is what we have for now. In terms of children and women generally, naturally women, we are caught up with being bothered by a lot of things. We must look at the fact that at this stage, there are a lot of people that are worried. There are mothers that are separated from their children, most especially for children that probably are schooling outside the country. We must look at mental wellness. We must look at how do we balance the fact that this is a time that we all get caught up with busy day activity, and these are moments that we tend to have with our children being on ground. How can we create awareness to have our children understand the fact that this pandemic is something that is not, even though yes, we shouldn't be that panic, but then we must take the necessary precautions. We must create enough awareness. Though we have social distancing, but if you have neighbors around you that you feel they are not well informed, there's nothing wrong either by phone or by maybe the distance you can maintain to let them understand the need to make sure that they are washing their hands, they are keeping themselves safe, and all what is necessary, the precautions that are necessary.
All right, let's talk about communication, which is at the core of how people are reacting to this COVID-19. Now, how would you assess the level of communication? Is it simplistic or simple enough for people to understand? Because when you go to town and ask people about COVID-19 or the coronavirus, some people still believe this thing doesn't exist. Some say, I've not seen anyone who has it, so I don't believe it is in the country, even when others are panicking already. What do you make about the way communication and information is going out there?
Well, the communication is very vital. Yes, there are people that feel, it has not come to our place, so why should we be bothered? But then we have to let them still understand that it's not a function of it has not come to our place. It's a function of we need to know that this is real. Coronavirus is real, and we need to take that precaution. We need to know that we need to keep our families safe, because what affects one now can affect thousands of people. Having that in mind should be enough for us to create the necessary awareness, regardless of what people believe or not. The fact remains that this pandemic is real. You need to take necessary precaution. We need to create the awareness no matter what. If it takes that we have to speak in our dialects, like what the Lagos State governor did when he was trying to, create this information, speaking in the Yoruba language for people to understand that, look, this is for real. We need to take care of ourselves. We need to take that precaution. We need to wash our hands, sanitize, our hand. If you don't have a sanitizer, get something. Make sure that you wash your hands all the time. Make sure that you are not so close to somebody. Make sure that even when you go to the market, which that is something with regards to women, we feel like, oh, we must get this, we must do this, we must do that. Sometimes we are naturally like like I said some time ago, that we are like that candle that tend to feel that we must even consume ourselves to light up others. But then we need to also know that we need to be there for our loved ones, and then make sure we take that precaution.
All right, Tessie Biobaku, thank you so much for talking to us on TVC Breakfast.
Joining us via Skype from Bonny River State is Tessie Biobaku, a gender advocate. Good morning, Tessie. Thank you for joining us.
Good morning.
Now, one critical aspect of this pandemic is communication, and we understand how children can be in the face of a situation like this. How critical is that aspect, especially for parents, engaging their children to making them understand what is going on?
Well, at this stage, we really need to engage our children to understand that this virus is for real, and necessary precaution must be taken. And for us to get the children more engaged and to communicate with them. You know, children naturally, it's not what you tell them, it's what they see you do. So you must be that example, in the sense that whatever you do, what they see you do, as in with regards to your hygiene, with regards to taking care of washing your hands, staying away, making them understand that they need to stay away from where you have people that are crowded. Understanding the fact that probably, you know, children are prone to having cough and all that, knowing that they need to take care of when they're coughing, the way they need to cough, either cough into a toilet roll or having to do their hands this way. And then they must make sure that they stay away from anybody in order to just take that precaution. So it's important that we become that example to them.
All right, it seems we lost that signal. Oh, okay. All right, Tessie is back now. I understand
Yes.
she's back. Now, Tessie, yeah, it's good to have you back on. You were saying something.
Okay, so I said that communicating to children entails that we must be that example as well. Most times when we tell our children to do things, they see what we do. So we must be that example in making sure that we take this necessary precaution, and also let them understand that it's not a function of because they are children. Though from the research, for now, from the Chinese Center for Disease, we have that women are less likely prone to this disease, but it's not as if it's zero. So there's need to take that precaution. Let them understand that, look, you must abide with regards to if you're coughing, stay away from people. If there's anything you observe in terms of your health, you should be able to get across to your parents, to mommy or to daddy. You must be able to know that in anything that you touch, or if peradventure you go outside, probably to play, the first thing when you get into the house is to use your hand sanitizer or to wash your hands. And of course, whoever they mix with, as in even having that social distances, they should be able to also communicate same to them.
All right. Now, if we compare the Nigerian health system with the ones in the West and all of that, there's always a very sharp difference with when it comes to the standards. Now, if we bring it back home, how much more will this coronavirus affect or impact women and children differently?
Well, unfortunately, our health system is not good enough at all, and I think with this pandemic, probably the government will look into making sure that focus is on the health sector. It's sad that the most important thing, because for you to be functional, you need to be alive, and the health sector plays a great role in this. Having known that we don't have a health sector in place, I think the best thing is for us to know that we need to really take precaution. You know, prevention right now is better than cure.
So how do we keep the children and even the mothers who are said to be vulnerable safe?
Well, for the children, part of keeping them safe is to make sure that they are well tidied up. For those that have probably nannies that come and goals. I think this is a time for them to let the nanny stay away, because you don't know those they are mixing with and they are coming to take care of the children. Unfortunately, with the school closure, and you have a lot of women being caught up with the health sector, it's going to be a lot of stretch on them. We're looking at balancing the fact that we need to have the women have their mental stability, because it's a lot of pressure on with regards to the women taking care of the home front right now. To keep the women safe, I think also the men need to come into this. We need to have more awareness and more teamwork. It's not a function of, oh, maybe you need to take care of this or that. It's a function of, we need to do this together. In doing that, you're giving great mental stability, which is very important at this time.
All right.
All right.
We have to leave it here now. Thank you very much, Tessie Biobaku, for talking to us on